Welcome to our series, Understanding Cancer, the Truth, Treatment, and Myths with the John Wentworth Cancer Center located on East Route 34 in Sandwich. Call the John Wentworth Cancer Center at 815-570-5006. Welcome back to our weekly feature here on WSPY with the John Wentworth Cancer Center. Our guest again is Megan, the radiation therapist at the John Wentworth Cancer Center. Megan, how are you doing today?
Good. How are you?
Doing really good. Good to have you back here once again. Today we're going to take our listeners through a step-by-step process. What takes place from day one when they come into the John Wentworth Cancer Center, right?
Yes, that's correct.
Okay. Well, why don't you go ahead and start us off with day one and what we're going to see and what we're going to learn as we go through the process.
Okay, so let's say a patient, they do find out, okay, I have cancer, wherever it is, whatever it is. Their physician that they see when they find out they have cancer, they're going to say, okay, maybe you might need some radiation. That's what I'm kind of thinking. Maybe that's what the direction we need to take. So then they're going to come and see us. So their first day is basically a patient consultation with Dr. Cater. And the patient basically comes in, meets with the doctor kind of examines them. And then based on the referring physician's notes, some pathology reports and imaging such as like CT, MRI, X-ray, ultrasound, doctor then decides whether the patient is a good candidate for radiation. Okay, so the second step after that is what? So then after they come in for a consultation, a few days later they're going to come in for a CT scan. That's one of the things I do. The patient comes in. A CT scan is very simple, about 15 minutes. Me and doctor work together. We discuss it, how the patient should be set up on the table. Right. The way they're set up on the table in the CT is the way they're going to be set up every day for treatment. Okay. We have a number of different devices that we use, but every device is different depending on the site where the cancer is. If it's brain, breast, prostate, all different things. Some of the devices we use a mask for brain. Starts out as hard plastic. We put it in hot water. It softens, and we put it over the person's head, and it kind of helps them not move. It immobilizes them. That's what these devices are used for. We also have something called a vac lock that we put around patient extremities. For instance, like if we're treating a pelvis, it goes around their legs. It helps them immobilize their hips, their legs, so that we can recreate a setup every day. So we set up all that. They go through the CT. Once I'm done with the scan, I send it to physics. Our physics department then plans with doctor how many treatments they're going to get, the dose, different angles that they're going to be treated at. All that is done in physics after the CT. Wow, that's a lot of stuff that I don't think a lot of people realize that much, and this is only the second step of the process. What's next? Yeah, that's true. So after they come in for what we call, the CT is called also a simulation day. They come in then for what we call a block check. Block check basically consists of a dry run. We're just taking images of them. We put on some temporary marks in the CT of where we think we're going to be treating. Physics then tells me, okay, this is exactly where I want to be. So I make some shifts using our lasers in our room. We shift on the sides of the patient, on the front of it, so I get exactly where we're going to be treating. And then, like I said, we take films of all the different angles that we're going to be treating at. Doctor looks at them. He says, okay, that looks good. That's exactly where we want to be. We use some bony landmarks. And he compares films that we take on CT day to the films I took in the room. That's some of the things that we do. Some of the common landmarks that we use is the carina, which a lot of people don't know what that is. What is that? The bifurcation of your trachea. That's located at thoracic spine 5. So it's right there where your lungs, it bifurcates. It turns into two pieces. That's where your lungs go, to the right and left lung. We use that a lot. We also use your spine. And we use iliac crests, which are your hip bones right there. Those are just some common things that we use. But yeah, so we use our films to make sure that we're exactly where we want to be. And when doctor feels comfortable, he gives me the A-OK with those films. And I say, okay, come in tomorrow. Let's start treatment. Basically, after the block check, we schedule a treatment day. They understand how many treatments they're going to get. That ranges depending on what kind of cancer. But patients come in 5 days a week, Monday through Friday. Terrific. Well, I'm glad you took us through that process there, because it makes people feel, I think, much safer, and also they feel much more comfortable coming in because they know that there's a lot going in behind the scenes to get you prepped up to make sure that they're going to get the right area that's going to be radiated, and that you're going to be treated just with the utmost care. Yep, that's exactly it. We take a lot of steps, and a lot of planning goes into it to make sure that we're very precise and that you're getting the best treatment you can give. That's what Dr. Cater wants to make sure that everyone knows, that we're giving good service, we're giving good treatment, and people can trust us because we're doing a lot to make sure that that's what's going on. Megan, thank you so much again for joining us, and we'll hopefully see you down the road here again, okay? Thank you. All right, that is Megan, the radiation therapist over at the John Wentworth Cancer Center, our guest on today's program.
Join us next week for our series called Understanding Cancer, the Truths, Treatment, and Myths with the John Wentworth Cancer Center located on East Route 34 in Sandwich. Call the John Wentworth Cancer Center at 815-570-5006.